Okay, Rabotai, we're going to get back into the halachot of a yoledet b'Shabbat, of a woman giving birth on Shabbat. Last week, we went through some of the halachot. The week before that, I went through some of the halachot. And we have, B'ezrat Hashem, tonight, the final few halachot related to both postpartum care as well as to the mother nursing a child. But before we do that, I'd like to briefly do a chazara and the past two shiurim, as this way we'll have a complete set and understanding as we finish up this year. All right, so just very briefly and very quick, some of the things we saw the last 2 weeks. Number one, we saw from the Gemara Masechet Nida that there used to be tzaddikim, hasidim, that they would try to plan the conception of the baby in the way that they would know it would never be born on Shabbat, right? If you have it at the beginning of the week, during the end of the week, whatever, they had a cheshbon, they figured it out. Obviously, it doesn't work like now today because, kids are born early, kids are born late. It's not an exact number, but the idea from that Gemara remains the same, is that perhaps you should do what you can to minimize the chilul Shabbat of giving birth on Shabbat. Very good. We said that last week also. That is true, that the neshama is not a Gilgal, and there's great tzaddikim that are born on Shabbat. All of this is emes. But still, we want to perhaps not be Mechal Shabbat if we don't have to. And as such, the Sefer Chasidim, and it's brought down, Halach L'Maaseh Yalkut Yosef, a person should daven that his wife, daughter-in-law, does not give birth on Shabbat. The Kaf HaChaim argues and says, don't get involved with Hashem's plans, right? Don't. But L'Maisa, we want you to daven that you shouldn't have to give birth on Shabbat. Mishnah Berurah learns from this Gemara and from these sources that a person should minimize Chilul Shabbat. Therefore, if you're in the 9th month and you know she can give birth any day, and it's Shabbat, prepare the go bag, right? The bag that have the stuff ready to go to the hospital ready. Take out the stuff that are not supposed to be in there. Put the stuff that you're going to need in there. Also, have a light on in the room nearby or one of those Shabbos lamps, whatever. So therefore, if you have to look for something, you're not going to have to do extra Chilul Shabbat and turn on the light and stuff like that. We talked about, does she need to rent an apartment or hotel near the hospital? Does she have to stay in her house? Can she go further away on Shabbat if there's a simcha or something like that? And we saw that it is possible to go away, even though it's further to the hospital, because it's not 100% certain she's going to give birth on that Shabbat. So therefore, the person would be allowed to go away for Shabbat, even though it puts them further from the hospital. We saw that if she can walk to the hospital, yoter tov. But if she can't walk to the hospital, you can definitely travel by car.
Those days, talking about 2,000 years ago, was no hospital, was nothing. Everybody was having their babies in the home.
Right.
The home was not doctor, was not light, was not this, was not that.
Very good.
So it was not too much Chilul Shabbat.
Okay.
What Chilul Shabbat?
So they're able to prepare a candle beforehand.
So why they needed to daven not to have a baby in Shabbat?
Because there's still things they're going to have to do as a Chilul Shabbat. Even though it's you're saying less than it is today, right? Still there is some Chilul Shabbat. Any Chilul Shabbat you want to avoid. We also talked about that if you know you're going to travel by car, to prepare the car in advance. Shut off the lights on the inside. Make sure the air conditioner is on, off, whatever you need already from beforehand. So when you turn it on Shabbat, you don't have to press extra buttons. Okay, that was briefly from the first year. Continuing the first year, we also saw at what point does she become a chola sheyesh bo sakana? At what point is she considered that she's at risk of danger of her life and that you're allowed to be mechalel Shabbat for her? So the Gemara brought 3 different opinions. The Gemara brought the opinion of being on the birth chair, which would be on the hospital bed, that she is bleeding from the area, and she can't walk straight. And there are those Rishonim that want to say, take the latest time, right? And the Ramban was very like, what do you mean take the latest time? It's the Pekuach Nefesh case over here. Take any of the times, whatever happens, she becomes, a Yoledet becomes a no matter what sign happens. Once she comes into active labor, you're letting a lot of Mechalel Shabbat for her. The Taz, The Mishnah Berurah said, very nice, like if we Mechalel Shabbat for her now that she's in active labor, but that's not going to help me because I'm not going to be in the hospital yet, or I'm not going to be able to call the midwife yet, right? If I'm going to wait until she's in active labor, by the time I get to the hospital, by the time I get to the midwife, it's going to be way too late. So therefore, the Mishnah Berurah says that once she starts regular contractions and she becomes what's called in labor, even though she's not in active labor, she's actually about to push out the child, at this point, you can already do the stuff that you have to Michalel in order for her to be in a safe place to deliver, whether it's to get her to the hospital, whether it's to bring the midwife to her, whatever is needed. As soon as you know that she's going into labor, right, and it's becoming regular intervals of contractions and stuff like that, I'll pee the matzav, whatever the matzav is in that case, whatever the doctor says to look out for, whatever you feel, whatever she feels, at that point you're allowed to be Michalel Shabbat to get to the hospital or to call the midwife to have them in the place. The rest of the stuff, you could only Michalel Shabbat once she's in actual active labor. Okay? Traveling to the hospital, this is all from the first year. Traveling to the hospital, there is a machloket poskim. What's the better way to do it? Is it better to go in your own private car? Is it better to get a guide to take you? Is it better to go in an ambulance? All right? So, if the guy can take you, it's better. Okay? It's less mechilul Shabbat. If you can pay the guy beforehand or pay them afterhand or something like that, set up whatever the payment, set up the time, it's whatever what you can do to lessen the chilul Shabbat, better. If you couldn't lessen, right, and you need to drive her yourself, you can also drive her yourself. Rav Mordechai Eliyahu said, better to go in an ambulance. Going in an ambulance, everybody's calm, meaning professionals are on the scene, right? The husband's not worried about being behind the wheel. The woman is calm. She knows professionals are there, and they have a siren. They can go through things. If you have to choose through vehicles, Baruch Hashem, this guy has in his garage 10 different cars. All right. If he has to choose, he's not taking an ambulance. He's not getting a guy. He's driving himself. Right. We said he should choose the smallest vehicle that requires the least fuel. Right. And they'll have the least chilul Shabbat by using that. Then we said if he has an electric car, that's even less chilul Shabbat. He should choose his Tesla versus a different car. So just to keep the cheshbonos as we go. Now, the Gemara also said, since, and this is the way Chazal explained, the Chum explained it, since this woman who's giving birth, she is a chola, she yesh by sakana. However, it is a regular, normal course of events. This is what happens. A woman gets pregnant, a woman gives birth. And only one in a very big number actually gets into such scary situations. At-risk situations. As such, even though she's the Chosh Yesh B'Ei Sakana, and usually in all cases of Chosh Yesh B'Ei Sakana, we say, Michalel Shabbat, Kiragil, regular, don't make Shinuyim, because don't start to say, should I make a Shinui, should I not make a Shinui? It's a suffix. We just do what we have to do. But when it comes to the woman who's giving birth, we should try to do stuff with the Shinui. We should try to do things with the Shinui when we're Michalel Shabbat for her. However, if you cannot do it with the Shinui, or it's going to be a delay in care that's going to be affected, then don't look for the Shinui, do it regularly. But most times when it comes for a woman, when she's giving birth, it's a chola sheyesh b'Ei sakana, but you can try to make Shinui when doable, because it's a regular type of course of events for her body. Okay. Then the last topic we spoke about last week, and then we'll start our new topic today, which was how much Chilul Shabbat can we do for her? Meaning, she is blind. Okay? She cannot see. She does not need lights. And she says, that's the case of the Gemara, and she says, turn on the lights or light a candle on Shabbat. And the doctors, the midwives, the nurses, everybody who's attending to her, they have enough light. And she says, put lights. And she has no benefit from that light. Can we turn on the light? And the halacha is yes. The halacha is yes. Why is the halacha yes? Because it makes her at ease. It puts her at ease. It makes her calm down. She thinks, even though she's blind, she thinks if I put another candle, they're going to see better. They're going to notice me better. They're going to notice the baby better. They're going to do a better job. So since it will calm her down, it's allowed to be done. So we see things that are not necessarily really needed, but yet she wants it to calm her. One would be allowed to do, one allowed to do Chal Shabbat for her. Obviously, if you could do it with the Shinoi, that's the way you should do it.
Why we don't tell him today is Shabbat? Something like I asked this also last
You
time.
did ask it last time. I was going to say you asked it last time too.
And it bothers me. It bothers me because in Yom Kippur we tell the if she's pregnant today, Yom Kippur, So maybe she's
Right.
going to consider.
Right, but she's not pregnant here.
What?
She's not pregnant here. She's in active labor.
Okay. So
She's now, when you're pregnant, you're pregnant. You're a regular person.
Okay.
When you're in active labor, you're chol sheyesh bo sakana. A chol sheyesh bo sakana, you'll have chal Shabbat for her. So she says, I need something, and you need something. That's it. Tzricha ani. She says, I need it. I need it. That's the way it is. So then the question that we dealt with last week was when she gets into the ambulance or she goes in the car and she says, I want my husband there, I want my mother there, I want my mother-in-law there, and I want my sister and my
brother,
the whole avlot, okay, the whole mishpacha, the whole block, okay. Yeah. So basically, she wants a lot of people to come, and her doula. Don't forget the doula, okay, and she wants the doula as well.
Well, that's going to overwhelm her. So they get overwhelmed at all these people.
No, we're gonna have a bath for her.
Okay, so what can we do? So there were some poskim that said, no, listen, she only needs one person. Let's probably go through Chaim with your shita. Listen, you only need one. Why even the Chal Shabbat more? Relax. We got you. Other poskim say, no, if she says Tzrichani, then I really need this. Then she says Tzrichani, I need it. And then she can get what she wants. And in fact, our poskim will say, you can make a bus stop. You can go from one place to the other, picking up everyone who she wants there. All right, on Shabbat, go pick up the doula, or you can tell them, come to the hospital, and all that can be Chal Shabbat to come to the hospital to be with her during her birth.
Which other mitzvah would be something? I don't understand.
It's someone who's sick. She's not
gonna die if you're not gonna do it.
If she needs it to calm her down, you're allowed to do it. Obviously, it has its limits. If she's asking for her brother and everyone else who really has nothing to do there, then unless her brother is someone who works in the hospital and has some connections and understands what's going on and is a doctor or something like that, I really don't see. At some point, you'll have to tell there's no more space in the car. Okay, so not figuring what else out. All right, very good. It has to be done with chachma, but the idea is that her mother and mother-in-law, anyone that she thinks that she needs there, technically can come, including the doula, including the doctor that she has private or whatever it is. They can all come because it put her mind at ease. Okay, we also dealt with that child arrangement should be made prior to Shabbat. If she didn't have to go to give birth, there should be a neighbor available, a brother available, an aunt over, whatever it is, someone should be there. And if there wasn't, then you're allowed to drive the children to somebody who could watch them, right? Let's say no one of the neighbors can watch them. There's no family nearby, and the family lives in the next city. So whatever it is, wherever they are, you have to drive to them. Technically, you're allowed to do that because it would be a sakana nefashot to leave the children alone. Children alone is a bad idea, okay? Because they can get into all sorts of mischief and put themselves in sakana. Therefore, you were allowed to be Chal Shabbat to take the children to a safe place. We talked last week also about going to a further hospital, right? Let's say there's a hospital right near me, not such a great hospital, and there's a better one further down. So we said that technically she can go to the further hospital, right? Because that puts her mind at ease. She knows it's a good hospital. She has her documents there, pre-registered, her doctors are there, whatever it is. That's the hospital. She doesn't have to go to the closest hospital. However, it has to be something that has to relate it to her medical case. Meaning if she wants to go, really not she, let's say he, whatever it is, she wants to go to a further hospital, not because it's a better hospital, but rather they have a better kashrut. They have a higher standard of kosher in that hospital, right? Rav Wozner says that's not a criteria to go to a further hospital. You would have to go to the closer, better hospital rather than a further one that has a better kashrut. However, other poskim point out that if the further hospital is better in shmirat halacha overall, not just in kashrut, but overall, meaning in dealing with Shabbat, right? In Eretz Yisrael, most of the nurses and everybody that work in the hospital are Jewish. So some hospitals are better with, how to avoid being Mechalel Shabbat and doing stuff with Shinuyim, doing stuff that are lesser issues, right? and other hospitals are less careful, some are more careful, some are less careful. So going to a further hospital that is more careful, that would meet the criteria for a reason to go to a further hospital. We also saw that with a Kohen, and the wife is going to give birth to possibly to a baby boy, and don't want to be in a hospital where there's a mit, and you know there's another hospital where there is no real dead people there. It's a hospital that doesn't deal with such age population, right? So perhaps going there would also be okay and not be an issue, and person could go further and to drive to a further distance. We talked about when you're getting to the place that the car should really not be turned off. It's better to give the keys to the security guard and let them take care of it. But if you're in your place where they won't do that, it's probably a danger to leave the car on. And as such, a person could shut down the car and carry the keys away from the car if need be, if it's going to cause it could be a serious case of kids can find it, teenagers can get into it, or something like that. Then he has permission. It is a dangerous case. He'll have to shut it off.
To the hospital, and you have, like what are they called? When you come like in the airport where where you drop them off
right.
It's like I don't know what it's called. It's not concierge. Like you drive in and then you're supposed to drive. You're not supposed to park.
Right, right.
So if you just stop the car over there, then they're screaming at you like, what are you doing? You can't just.
I found that because the last 2 kids we gave birth at night, and we came to the hospital at night, and I drove my wife, and I just left the car in the front, and I walked in and I told security, we're coming to give birth. I left my car here. Do I need to give you the keys or whatever? It was like a weekday. And he's like, no. When you finish the birth, you can come back and move the car. It's both at LAJ Cats and as well as South Nassau over here. So just leave the car. Maybe because it was overnight and they're like, no one's going to bother you anyway. So I just left the car there. And then after the birth, I came back out. But the whole time, well, I didn't like it, but the whole time it was on my mind during the birth. I hope they don't move my car. I'm not going to find it afterwards. Right, tow it or something like that. But Baruch Hashem, we came and we found it. So yeah, it's something like that in front of the hospital, leaving the car.
Or whatever,
right, and tell the security, here's the key, whatever it is, and move like that. Okay, those are all now. That was just a chazara. That was a quick review of the last 2 shiurim. So let's get into our shiur for today. We're on page 41 in the Tzurba, volume 22, the Lax Family Edition, the Dr. Harold and Magda Katz volume. Okay, we are on page 41. Rabotai, we started it, but we didn't get too much into it, so we'll start again. Okay. So we saw when she starts to be a cholesh yesh boy sakana, page 41. Now the question is, when does that classification that she's a cholesh yesh boy sakana, when does that classification end? When is she no longer a cholesh yesh boy sakana? We have an extra book over here. You can pass one book right down.
When she's in the hospital.
No, over there. There's one by Chaim in front of Chaim. You can pass it down.
Oh.
Rav Yosef is over there. He needs it.
Yeah.
Okay. So says the Gemara. Ad motai petichata kever. When is it considered that the kever is open? When is it considered that she's a chodesh yesh by sakana? Amar Abaya shloisha yamim, 3 days. Rav Omer Mishmei Rav Yehuda Shiva. Rav says 7 days. V'amar la, and others report it as shloishim, as 30 days. So you have 3 opinions. She's a chodesh yesh by sakana for 3 days. She's a chodesh yesh by sakana for 7 days. There's a chodesh yesh by sakana for 30 days. Omre nehar da'ai. The nehar didn't say haya, someone who just gave birth. Gimel, Zayin, Velamed. 3, 7, 30. Then it's actually all 3. It's not a machloket. It's actually all 3. Gimel for 3 days. Bein amra tzricha uvein amra lo tzricha. Whether she says I need it, whether she says I don't need it, right? She is considered a cholesh yesh boy sakana. It's a pekuach nefesh case, and you do it for her. Mechalin alein et Shabbat, even if she says I don't need it. Mechalin et Shabbat, you mechal Shabbat for her. You do what she needs. You know what she needs. The doctor knows what she needs. You do it even though she says I don't need it. Zion, from day 4 to day 7, Amra tzrichani. If she says I need this, mechalin alei Shabbat, then you mechalel Shabbat for her. Amra loy tzrichani. If she says I don't need it, right? Amra loy tzrichani, Ein mechalin at the Shabbat. Then you're not mechalin Shabbat for her. Lamed, and for 30 days. What's the 30 days? Afila amra tzrichani. Even if she says, I need it. Ein mechalin at the Shabbat. You're not mechalin Shabbat for her. We do it through a guy.
This is after the birth, right?
Yes. So from after day 7 to day 30, she gets the classification of a chola she'ein boy sakana, which you can do things with a guy. Just tell the guy to do it. All right? She gets a din of a chola she'ein boy sakana. So you have here, the Gemara tells us, from the birth till 3 days, she's a chola she'yesh boy sakana. Even if she says they don't need it, you still do it for her. From 3 to 7, so from 4 to 7, if she says, I need it, you Michal Shabbat. If she says, I don't need it, don't Michal Shabbat for her. And from 7 to 30, it's a chola she'ein boy sakana, and you can only do stuff through a guy or through a shino if it's the Rabbanon, like we spoke about in the past. Okay. Now, let's take a look at the Shulchan Aruch. Shulchan Aruch in source 37. Kol shloisha yomim harishonim. The first 3 days. Afilo amra ein tzricha. She said, I don't need it. Mechal in aleya et Shabbat. We still mechal Shabbat for her. All first 3 days, you do whatever needs to be done for her. She said, I don't need it. You still do it. Mishloshav ad shiva. From 3 to 7, amra ein tzricha. She said, I don't need it. Ein mechal. Then we're not mechal Shabbat. Okay, but she said, I need it. Then you would do it. Mikan ve'elach. Afilo amra tzrichani. From 7 to 30, if she says, even if I need it, she says, you're not mechal Shabbat for her. She becomes like a chola she'ein boy sakana, which means you can do it through a guy. Okay? Now, this we understand. You have 3, 7, 30. 3 you do. 3 to 7, if she says she needs it, you do. 7 to 30, only through a guy. When does this? When is 3 days? What does that mean? 3 days. When does it count from? This is a machloket rishonim. At what point is it considered 3 days? Is it 3 calendar days? So I gave birth before nightfall. That is day 1, and nightfall is now day 2, and the second nightfall is now day 3, and that's it. Or is it me'et le'et? Is it every 24 hours? So if I gave birth at 6, so I have 24, what's I have 24? 24, 48, and then 72. Do I have 72 hours after birth? And it's me'et le'et from the time it's given birth to that 24 hours later? Or is it calendar days? So we have the Rosh, and the Rosh here tells us, and we're going to see that the Rosh is really explaining a shita. He's explaining a shita of the Baal Halachot Gedolot, and in there he says the mechalalein alei et Shabbat shebe'et yamim Shabbat yamim me'et le'et. You can mechalel Shabbat for 7 complete days me'et le'et, 24 hours. So if she gave birth at 6, you have 72 hours later, and you can be mechalel Shabbat for her. Once the 72 hours expire, then only she says, if I need it, then you have up to 168 hours. Okay? It's me'et le'et. The Trumat Hadeshin says, no, lo chashiv lehu me'et le'et. It should not be counted from 24-hour period. Rather, lifi seder hayamim. We should count it as per the days. When night falls, it's a new day, and that's day 2 already. Right? So if she gave birth at 5 p.m., yeah, it's Yom Kippur. It's we're going calendar days. This was 1 day. Now the night falls is the 2nd day. Second night's the 3rd day. That's it. Not 72 hours. It can be less than 72 hours, much less. That's what the Trumat Hadeshin says. And the Trumat Hadeshin says, don't look at the Rosh in the 2nd paragraph. He says the Rosh is explaining a shita of the Baal Halachot Gedolot, and we do not paskin like that shita of the Baal Halachot Gedolot. So therefore, don't even pay attention to the shita of the Rosh, and it's not me'et la'et. It's not the 24-hour period. It says the Trumat Hadeshin, and the Shulchan Aruch surprisingly holds like the Truma tradition. Look at the Shulchan Aruch in source 40. And says the Shulchan Aruch, Beferush, on page 43, says the Shulchan Aruch, V'yamim elu en monin otam me'et la'et. You're not counting them 24 hours. You're not. You're not doing it. He says the way you count it as calendar days. Okay? And the Kim Shnichas Yom Revi'i, it's already, this is considered after 3 days. So you go by the calendar days, says the Shulchan Aruch. He is machmer like the Trumat Hadeshin. Because when I say you would think Pekuach Nefesh cases, you want to be not l'chumrah to save them, not l'chumrah to say it's lesser time. So Shulchan Aruch surprisingly goes with the opinion of the Trumat Hadeshin and not like the Rosh. The Mishnah Berurah, he rules with the more lenient view. And he brings down that even though the Magen Avraham says it's a calendar days, but then he says, look in the Gra, and the Gra says that you take it as a 24-hour period. And therefore, says the Mishnah Berurah, Ben l'Shabbat, Ben l'Einyan Yom Kippurim. You go for 72 hours. She's considered for sure a chol sheish bo sakana. It goes me'et la'et, 24 hours. Mishnah Berurah, the Vilna Gaon are both saying it's 24 hours, 72 hours, 24-hour periods. 3 24-hour periods, 72 hours total. And it's not calendar day. Once night falls, it's the next day. Now, let's take a look. And the Yibia Omer on page 44, source 42. So right now, we saw the Shulchan Aruch, we saw Mishnah Berurah, we saw the Gra, Magen Avraham. So if I would tell you, Chacham Ovadia, who does he usually go with? Shulchan Aruch. So what does Shulchan Aruch say? We don't do 24-hour periods. You don't do 72 hours. You go calendar days. Once the calendar changes it. So what would you think Chacham Ovadia would say? Like Shulchan Aruch. And he doesn't. And this is even more surprising. So he writes over here in the Yibia Omer, source 42. He says you have over here, you have a whole group of prophets over here. That it's a 24-hour period. Now he writes, even more surprisingly, if the Shulchan Aruch would have saw all these Rishonim that we brought, who they include, the Baal Achot Gedolot, Eshkol, Veharosh, Veharasha, Veharitva, Vehor Zarua, Vehisr Veheter, the Kulu Sphere Lehu, the Me'et Le'et, Haya Posek Kidivrehem. Then the Shulchan Aruch would have gone with this opinions. Okay? So he's saying that Shulchan Aruch didn't have all these Rishonim in front of him. He only had who? Before. But these Rishonim were before Shulchan Aruch. But he didn't have all of them. He didn't have the Sfarim. He didn't have the books. He didn't have those sources in front of him. And so whatever he had, based on what he had, he poskined this way to say they go to Chumrah and it's a calendar day. So he's saying the Al-Qudsha said that if he had all these sources in front of him, right, and he had all of these, he would not have poskined like the Trumat Hadeshin. He would have poskined like this other group of Rishonim. Especially when you have normally Safek Nefashot Lahakel. So therefore, he says the conclusion is it's me'et la'et mishat halida, from the time that she gave birth. The moment of birth, that's the moment when it starts to count, and you have 72 hours from there. The Hainu B'toch Shivat Mishnayim Sha'od. You have 72 hours. Okay.
They just, discovered the eerie snakes and
I hear what you're saying, and I'm going to say, like, let Chamavad decide when's the time that the Shulchan Aruch would have poskin different. I'm not going to say Shulchan Aruch different. Chamavad just said it, and we have what to rely on. He does this in multiple places. Okay, even though he's almost always a purist, like the Shulchan Aruch, and like really goes exactly what the Shulchan Aruch says. There are certain times where he says no. You have all these Rishonim. He similarly, Chamu Yitzhak Yosef does that in a tshuva about using an eruv, right? An eruv to make an eruv, like we have over here, right? And right. So Chamu Yitzhak Yosef says, oh, you have all. He brings all this the poskim that say it's okay, and he says therefore it's okay also. In cases of people who are not bnei yeshiva or people who really need it or something like that. So they do use this process of listing a lot of poskim, rishonim, whatever it is, and then say, because you have this big list, you have what to rely. Maybe Shulchan Aruch would say like this, or whatever the story is. But this is the way L'maaseh we paskin, and this is applied to both Yom Kippur, right? So the first 7 days after giving birth, she should not be fasting. First 3 days for sure. And from 3 to 7, as long as she doesn't say, I'm good, I'm going to fast, right? She doesn't have to fast. Okay? But in the first 3 days, even if she says, I'm good, I want to fast, you don't let her fast. That's the first 3 days. And the same thing for Hilchot Shabbat. First 3 days, Mechel Shabbat for her regardless. And after the first 3 days, you need, what's it called? She needs to say that she needs it. I don't know what the hospital used to do. I know that my mom says that back, and people said it back in Russia. They kept them there for weeks. How many weeks they so I don't know what they used to. I think they used to also keep them there longer. It was even longer. Back in the days, even longer. So that's what we were saying last week. We were saying what the hospital does and what the halacha is not necessarily have to correlate. The halacha is the halacha, right? And the hospital does what the hospital does. You have to remember, and we'll just say, Bagav, you have to remember, hospitals have to turn patients around. Meaning, you got to move people out. There's, especially in New York City, there's a limited amount of beds in every hospital, and the people that are coming in, there's just not enough place for them. Right? This is almost every hospital deals with this crisis on a daily basis. Hospitals have to close down the ED. They have to divert every ambulance to go to a different hospital because this hospital can no longer take in patients. Okay, they go on what's called diversion, and then the next hospital goes on diversion. And then what do we do to alleviate this? We throw patients out, not necessarily throw them out, but we discharge patients who are not yet ready to go home. But we'll find the ones who are more stable than the others, and we'll take a chance and say, okay, do this, and that, give him an appointment here, give him an appointment there, give him an appointment there, and get them out in order to clear up a bed for them. For the next patient that's in the ED, you can't be in the ED is a wild house. So you have to understand the hospital does its thing to get people out. What we call, you get them out sicker and quicker. That's what the lashon is, all right? Sicker and quicker. That's what happened nowadays. You get them all out. And the challenge is, just tell you how it works, the challenge is to keep them out of the hospital for 30 days. Why? If they come back within 30 days, no insurance pays for it again. All right? The hospital gets faulted, they don't get paid again. So if you sent out the patient and they come back within 30 days for the same thing, right? Then the insurance won't pay the hospital again. And the hospital has to take the patient, and they won't get paid. And the patient doesn't have to pay it, and the hospital gets faulted. Right, that you take a loss. Right. So some hospitals, I don't know if they actually say, but sometimes they tell the patient, maybe try a different hospital next time, right? So they go somewhere else. Or they tell them, you come back day 31. If you tell someone to come back 31 days, they'll somehow keep out of the hospital for 30 days. And this way they don't have to come back. Just give you some of the secrets of what goes on in hospitals. Okay, moving on to the halacha. Okay, let's take a look outside. Yes, Malkiel.
Good question. So if the husband's with the wife, when the day she gives birth, the next 2-3 days they're in a hospital, even though the nurses come in and the aides, they come in and help her, the husband could violate. If
Yes.
they're on Shabbat, he could violate. If it's the second day, the third day, whatever, he could violate Shabbat for her, even though they can still come in and help her out with things.
Right. They could. He could, technically. And if there's going to be goyim there that are there and you can get them to do it, that's going to be better. But
so better to call them.
Yes, it's better if you can get the guy to come in. But if she's alone or the husband really needs someone really quick to come, because sometimes even though you're there, you can't do anything for her, right? You have to get them, and they're not around sometimes. You open the door, and there's no one there. So at that point, you need to get someone. You need to get someone. You can press the call bell and stuff like that for sure. Yeah. Okay. Fine. Let's take a look outside the Tzurba for a moment, just to say the way the Yalkut Yosef goes through these halachot about the days. Okay. For the first 72 hours after a woman gives birth, she has a halacha of a chodesh sheyesh bo sakana. We desecrate Shabbat for her, even if she claims she doesn't need these things. We ignore her and proceed to Michalel Shabbat for her. After 72 hours, until a full week, which is 168 hours, we must still be Michalel, but only if she says she needs it. If she says she does not need it, we follow her, what she says, and we don't do it for her. After a full week, we only get a guy to do something for her, right? From a week to 30 days. What happens if the woman miscarried? Does she get a status of a chola? Sheyesh bo sakana or not?
No.
Amen. Now the question is, if a woman gave birth, but it was a miscarriage or something like that, is she considered a chol sheyesh bo sakana or not?
It depends when, no?
Yeah. So if it's she's pregnant for at least 40 days, she has the status of a woman who gave birth, and you must desecrate Shabbat for her according to this schedule. So if someone had a miscarriage after 40 days, she is considered a chol sheyesh bo sakana for 3, 7, and then 30 days, 7 to 30, chol she'ein bo sakana. Same exact schedule. Now, in the Chut Shani over here, Rav Nissen Karelitz was asked the question, or asks the question, what happens? The woman didn't give birth, but she had a C-section. It's a cesarean section, right? So they pretty much cut her open and took out the baby. Is she also on this schedule of 3, 7, and 30? Or is she not on this schedule? So Rav Tzurba says it's even worse. So the Chut Shani says over here, number one, he says, listen, when you're giving birth, your whole body shatters, right? There's a whole movement, everything. Literally, the bones in the body move and come back and move out, and the whole it's everything shifts. Okay, so that doesn't happen during a C-section because you're not going through that whole labor process. But says Rav Nissen Karelitz that perhaps a cesarean section is even more worse because she's gone through the birth. By the way, she has a halacha of one who is in danger for more than 3 days, right? And it's dependent on the circumstance. She's gone through a surgery. You know, it might be even considered worse, might even consider more severe. He wants to say here in the here he didn't have it, but here in the Rabbi Nachshon brings down the halacha about the C-section as well. Let's take a look what he writes over here, page 328. Okay, he writes as follows, 323. I can't read my own handwriting. No, it's not a problem. Okay, a woman who gave birth through a cesarean section has the same status as a woman who had a natural birth. Okay, so Rabbi Nachshon wants to say, same schedule, 3, 7, 30, for someone who had a C-section as well. Here, just wanted to point out some other interesting ideas that he brings down over here. What happens if a woman is unsure she needs a malacha, and the doctor says you need to do it? So he's saying this is between the 3 and 7, not the first 3, between 3 and 7. Okay, she says I don't need it. Doctor says she needs it. The Shabbat or not? What was the Gemara? The Gemara says she has to say tzrichani. She doesn't say tzricha. She says I don't need it. And the doctor says she needs it. What do you listen to here?
First 3?
This is between 3 and 7. For 1 second. First 3, we do it for her whether she says I need it or not. Doctor says she needs it, you do it. Not a problem. Of course. Question now between 3 and 7. She says I don't need it. Doctor says she needs it.
The doctor will listen to.
So he says over here, Melacha should not be performed on her behalf. If she's saying, I don't need it,
Wow.
if the doctor says she needs something, and between 3 and 7, she says, I don't need it, she's not saying shrichani.
Whoa.
Now, as long as she didn't say anything, she didn't say, I need it, I don't need it, and the doctor says to do it, then you can do it for her. But if the doctor says do it, she says, I don't want it, I don't need it, then you can't do it for her. That's what he brings down over here from Hazon Ovadia and Halichot Olam. That's what he brings down. He's saying that if between day 3 and 7, she says, I don't need it, doctor says she needs it, you don't do it for her. Not Mechal Shabbat for her in that case.
I need a blood cell. I don't want to do it.
Is she a rational person?
No.
If she's not rational, that's a different story.
That's what I'm saying.
If she's a rational person, no, she knows herself. I'm a safe. I don't need to take blood. I'm good. I'm. And she's rational. She.
gotta say that she's not rational. The doctor's rational.
That's not what he's saying. He said between 3 and 7, she has to say I need it, or she has to say nothing at all. If she doesn't say anything at all, you can do it for her. Once she says I don't need it, then you can't do it.
Doctor always has to say. That's why he's
Not always.
That's his job.
Not always. Not always. Okay. All right. We saw this. Fine. It could be done through a goy, and if it's a derabanan, you can do it through a shinoi, and if it's even deraita, it's also perhaps doing it with a shinoi if no one else is around might also be okay. If there's nothing else that could be done. Okay. What about if it's not? It's after 7, but it's within 30 days, and she feels very cold. And she's home, and it's very cold, and the heater is not on. Call a guy. If you can't call a guy, you can do it with the shinoi, because a woman who just gave birth, even within 30 days, is very sensitive to cold, and cold can be very harmful to her. Right? In such a case, you should make sure you have the heat on before Shabbat. Make sure that it's working and stuff like that. What about I'm in the hospital? We just gave birth, it's Shabbat, and I want to let my relatives know. So I told my relatives, if you see a number from the hospital calling, and you should know that we gave birth, right? Or something like that. Can I tell the nurses, can you call this number, that number, and this number? No, I want to tell them on Shabbat. I want them to know right away. Right. So it's not necessary. You cannot do this. You cannot tell them to call, go call, let everybody know that we gave birth. Everybody who already was supposed to be there, she already brought them on the bus. So you don't have to tell anybody else. Okay, fine. That is on those topics. Now, let's move on into over here. Okay, the Bir Halacha, interestingly, the Bir Halacha, so the Chavetz Chaim in the Bir Halacha says, there's another opinion, that the 3 days is really starts from when she is in labor. So when she started labor, that's already day 1, not just calendar days, but it starts also from the time she actually went into labor, and that's the actual start of the 3-day clock. And he says he wants to say that from the Rambam. In the end of the day, in the Mishnah Berurah itself, Chavetz Chaim says it's count me'et la'et like we saw. Chavavadia says it's me'et la'et, it's 72 hours. Shmirat Shabbat Kilchata says the exact same thing. It's 72 hours after the end of the birth, and that's how a person should count it. So it's a very nice chart on page 46, going through when you can start to be Mechalel Shabbat for a Yoledet. So when labor starts, she starts having frequent contractions, 5 minutes, every 10 minutes, whatever it is. At that point, you can call the midwife, okay? And if necessary to get to the hospital at that point, you can also go to the hospital at that point. When contractions start or water breaks, right, one can travel to the hospital. When the woman sits on the birthing chair, the blood flows, or her friends need to support her until 3 days after birth, she is considered a chol Shabbat for her. From 3 until 7, if she says she needs it, or if she doesn't say anything and they say she needs it, you can do it for her. From 7 days after birth until 30 days, then she's a chol sakana, and it's something that can be done through a guy. Now, he doesn't bring here one of the topics that I want to bring up. Let's talk about the fetus for a second. The fetus the baby inside the mother's womb. Okay, so listen to what he says over here. Scary situations, but halakha. Let's say, Chas Shalom, there was a pregnant woman, and she was hit by a car on Shabbat, or she fell from a high distance, and she died from her injuries. So you came on scene, and you see she's dead, but she's pregnant, and there's a chance that her baby inside her is still alive. Possible. What do we do at this point? What do you do at this point? Okay, so it's just died. I don't know, a minute or two, the baby can still survive, whatever it is. Yeah. So we must cut her abdomen and remove the fetus so that he may be saved. If someone cut the abdomen, took out the baby, and realized the baby is dead, right? It's okay, because he thought he was going to save a life, and that would be okay. If a woman, Chas Shalom, dies while giving birth, she's in the hospital and she dies, you should go and perform the surgery to take out the baby, cut her abdomen to remove the infant and save its life. You do this on Shabbat. All right. So if you have a chance to save a fetus, you save the fetus. At what point do you save the fetus? How old does the fetus have to be? So he brings this. We saw this from the Ramban before in Torah Adam. He says a malacha may even be done if it's within 40 days of conception. Okay, that means right away, even if it's a small nothing. Technically, you can already save the child, save the fetus. I don't know. That's what he writes. How long can be done if it's within 40 days of conception? We saw this Torah Adam before. The Ramban.
It's only maybe a heart. Nothing else is there.
I don't know what to tell you. That's what it says.
Maybe you take it out with the feet. You take it with the shliach, with the womb.
And then what?
Okay. Let's talk one more thing over here. He writes.
It's good.
The tinuk, shenolad b'Shabbat, tinuk, the child that's born on Shabbat, also has a status. They can mechalel Shabbat for the tinuk, whatever you have to do for the kid. Okay, you may desecrate Shabbat to treat him whatever way, even if the child is born prematurely. Then in the times of the Talmud, this child would die. Right? Nowadays, we don't say the child's going to die, because what do we have? You have incubators, and you have all sorts of medications and medicines and whatever it is, therapies that can keep children alive. And even if they're born so premature, we can still keep them alive. Therefore, any child that's born, even if he's born with a severe disease or severe deformity, or whatever it is, everyone can be tried to be saved, and it could be mechalel Shabbat for them on Shabbat. We don't start making distinctions. Oh, this one's going to die, this one's going to this and that. We don't do that, because we say that our medicine, our advanced medicine, can perhaps save them, and therefore we save everybody as much as we can on Shabbat. Okay, and here he brings, one second, just another one halakha here. Okay, so we went through. Okay. Additionally, one may do malacha for a baby that is born with a serious defect, even if its chances of surviving are entirely very slight. So we don't make any distinction nowadays. Any child that's born, no matter how, do everything we can for them on Shabbat to save them. Don't make any cheshbonot. Yes, no. We save everybody. All right. Now we come to our final topic. And it's not really about giving birth, but it's post giving birth. Now you have the child, and you want to feed the child. And what's the natural food for the child? The mother's milk, nursing. Okay. Is there any halachot that the nursing mother should know about? So there's a Tosefta. And the Tosefta says that a woman should not ease the pain in her breasts by expressing the milk into a cup or a bowl and give her son to drink. Meaning, you don't want her to express the milk into a container or a bottle and then give it to the child. You want the child to directly drink from the mother. So let's take a look. Shulchan Aruch says the same thing. Lo takel isha chalav midadea letoch hakos or letoch hakidera v'tanik et mina. She should not take it out and put it in a bowl or a cup or whatever it is, and then give it to the child. Rather, she should give it directly to the child. Mishabura says, what's the issue? What's the issue of extracting the milk from the mother? Mifarik. It's a tolda of dash, of extracting juice from the fruit. So therefore, you can't do it on Shabbat. And the Shulchan Aruch then says, let's say the woman has the baby, and the baby is a fussy baby. The baby doesn't just latch on to the mother. The baby, you have to convince him to latch on to the mother. And the way to convince him is you have to have some milk, come out either on his lips or near him, whatever it is. And then once he sees it, he latches on. So Shulchan Aruch says, it's mutter for a woman to squeeze out milk so that the baby would take hold of her and start to nurse, right? If you have to do this. Now, there's the machloket poskim. What does this mean that she squeezes it out? Does it mean she squeezes it out on the baby's mouth? Or does it mean she squeezes it out to the floor? It just comes out anywhere, right? Where is she squeezing it out? Lamar said what we're trying to say here is that if she needs to do something to begin the process for the child to nurse, and it includes extracting milk from her, then that would be okay. Now, someone brought up the question. Sometimes the woman has a lot of milk and it becomes engorged and it becomes painful. And she needs to extract that milk from her. Otherwise, it's very painful and she can't continue. And the child is not eating enough milk, so it's not going to come out. She needs to get it out on Shabbat. So what does she do? Said the Shulchan Aruch, V'chein hi ba'atzma yochola lahotzi beyada chalav hamitzaer ota. She can take out the milk that is bothering her. Okay? So if it's pain, and she has pain, and she needs to take out the milk, she'll be allowed to take it out, and he says with her hand. Okay? We're going to see in a minute, maybe she can do it with a pump. Maybe she can do it with an electric pump. We'll talk about that all in a second. Now, where is she extracting the milk? She's extracting the milk because she has pain. We said you can't put it in a container because the container is okay. So
The waste.
on the floor. Right? You should have wrote the Mishnah. Still have a chance. Okay.
Is it the same halakha by the cows? Somebody has a cow and they don't want the milk on Shabbat.
It's similar issue. Mifarek of extracting the milk, right? The enze kederach mifarek kivan sheholech leibud. It's not considered mifarek when you pour it on the floor because when you do extraction of juice, you want to collect the juice. Here we're letting it go straight to the floor, so therefore it's not considered extracting the thing. And it's not a malacha that you want for its purpose. And so therefore it's only the Rabbanan, the Patur, Umishum Tzara, Lo Gazru. Chachamim didn't say it's asur to do it because there's tsar there, there's pain there. Yeah.
The cow also on the ground.
There's a similar situation with the same malacha is applied to both, right? Just like a cow, you need to extract the milk, right? That's so alo aretz, okay. So the Avnei Nezer says, hold on. Avnei Nezer says, you look around, women are not throwing it to the ground. Women are putting it into a glass vessel. They're putting it into a cup. One back in the day, that's what they had glass. So today you have the little plastic bottles. Hold on. So Avnei Nezer says they're putting in the baby bottles. That's what Avnei Nezer says. So Avnei Nezer says, you know why they're putting it there? Because they're about to throw it out right after. They're going to throw it out. They just say, I don't want it to go on my floors in my house. Who puts the milk, mother's milk on the floor? So I'm not going to put it there. So they collect the mother's milk into a container, and then they throw it out afterwards. And that's okay.
Neighbor keeps opening the milk.
Hold on, don't give me the neighbors yet. Let me finish the paper. All right. Now, the Chazon Ish says, no, this is not good. Chazon Ish says this is not good. You cannot put it into the cup just like that. If you put it into the cup just like that, you might get you might rethink it. Hold on, it's already here. I already have it. I have my neighbor. I have my this. I have my that. So the Chazon Ish says, what do? You have to put something inside it. No, you got to put something inside it. You put soap. You put liquid detergent. You put something that the child, you wouldn't give it to any children to eat. You're ruining the milk. It's as if you're throwing it on the floor. It's a right away. As soon as it goes into it, it's already not usable. So if the woman has pain and she needs to relieve herself by extracting the milk, she has to put it into a container that contains some substance that will ruin the milk. You can't use it.
You cannot drink it.
Cannot use it.
Problem is coming.
It's mifarek. It's a malacha. You cannot use it.
Affected psychologists, my milk is going way to that.
That's the halacha. Now, okay.
But how she is making it? Machine or how?
So the Shulchan Aruch say you do with hand. Okay.
Not possible.
Now, said the Shmirat Shabbat Kechatab, if she cannot take it out with her hand, with a pump designed for this purpose. So a pump. So the first pump you would like to use, if you have to, she has to use a pump, right? You would like to start with a manual pump. Okay? They have hand pumps. And by the way, all hospitals carry hand pumps when you give birth. You should have to ask them for it. All right? Tell them, can I get a hand pump, manual pump? If you ask them for it, you'll get it. You get it for Shabbat. Just get it on the end so you have it for Shabbat. Now, let's say she can't do the hand pump. It's too much pumping. Too much, can't do it. She's used to using the electric pump. Today, all the insurances give you an electric pump. Just tell them you're pregnant, you got a letter from the doctor, and you can get an insurance. You get the pump, the bottle, the whole Tesha Keges and everything. Right? You have like 4 or 5 of them at home already. So, and she wants to use that on Shabbat. You want to use that on Shabbat. Can't she use an electric pump on Shabbat? So she can use the timer, right? That activates the pump at a predetermined time. But you have to make sure a few things. Number one, you have to make sure inside the bottle where the milk is going to go, there's soap or there's some liquid detergent or something that's going to ruin it. Okay, that's number one. But there's even more when you're using the electric pump. And a lot of people don't know this, and it's important that they do learn this. What is some of the things that they have to do? So he writes over here. Number one, before the timer starts, she already has to get the pump on her. She cannot wait for the timer to start and then put the pump. She needs to know it's going to go on 10 o'clock, whatever it is, Lamashal. She has to already put it on her. Now that she has to put it on her, all right, she's not supposed to hold the cup at that time. That's supposed to hold it. She should put like a tight shirt or something like that, or some sort of apparatus to hold it into place. So she is not holding it. She's not holding it. Okay? So you want to have the timer, put it onto her before the timer, have it in a way that she doesn't have to hold the bottles to her body. Okay? And then okay, and then she can use that electric pump that way. And in the cases of need, if the child really needs it, then you can use that milk as well. You don't have to put anything inside of it if it's in such a case of need. But if it's not in a case of need, in a regular case, she just wants to relieve herself from that milk, then she'll have to put something inside the bottle, but she should still do it that way.
If she pump at the bottom, the baby needs it, the baby can drink it?
If there's no other way for the child to drink, yeah.
The child doesn't take room.
Okay, yeah, for sure, yeah. Yeah, that's not a problem. Okay, that's not a problem. That's you have a case of pekuach nefesh for the child. He needs that milk. Then he doesn't drink the milk. She can extract the milk. Like if you have a case where a child's in intensive care or something like that, and you have to bring the child the baby milk, yeah, you can extract it and bring it to him. Right? Even in that case, it's better to do with the shinui, to use 2 people to do it together at the same time. That's fine. But if we're talking about a case where she's relieving herself from the pain. So again, to do it with the hand is the best way. If you can't do it with the hand pump, right? Make sure the bottle has already liquid detergent or something and soap or something like that that ruins it immediately. If you can't use a hand pump, you can use an electric pump. When using an electric pump, you should have it on a timer. It should be put onto her body and held by itself before the timer goes on. Okay, and then that can be used that way. Okay, Rabbi Ribiat brings another idea over here. What about what they have? Sometimes they have, we're running out of time, nursing caps. Okay, so it's not a nursing cap is a plastic that they put over the breast, right, over the nipple, and this way, when the milk comes out, it goes into the cap. Sometimes they wear a pad. It goes into the pad. It gets wasted in the pad. But instead of a pad, there's a plastic container there, and the milk drops fall into there. Is that okay on Shabbat to use that? Right? Because we have by fruits, when you have dash, when you have mifarek over there, even if the juice comes out by itself, you still can't use it by the grapes and other stuff like that. So what about in this case over here? He writes over here that in this case, by the nursing, and therefore replacing the cap with the nipple for this purpose is not considered an act of schita. It's not mifarek, and it's not, and it will be allowed to be using that. So it's a Ribiat would allow that to be used, especially if a case where the child has inadequate milk and he doesn't do well on the formula and stuff like that. That would be allowed to be used. Okay, Rabotai, there's a very interesting machshava over here. We have a minyan, or we don't have a minyan yet? We have a minyan, okay? Okay, it's an interesting machshava. We ran out of time, but take a look at it on your own, Rabotai.
It's not like urine that can store in the bladder or something. It just has to come out like that. It actually gets converted from the blood.
Accumulate. Yeah. Rabbi Hanina v'kashem omer tzakash baruch hu zakor Yisrael lefi kach yibra lem tormes v'shnei emar Adonai chafetz leman